We're doing a patient education series on retinal detachment. Any questions you have are going to be solved in this series. And today's topic is, what are the causes of retinal detachment? First of all, there are different types of retinal detachment, which we'll be coming to later. We're dealing with the causes of rhegmatogenous retinal detachment. Rhegma means a break. So if you have developed a break in the retina, which is a hole in the retina, a tear, or something called a lattice degeneration, which is a weak area in the retina, there is a possibility that the retina starts detaching from there. So what has happened is the vitreous gel, which is in front of the retina, becomes a little liquefied and goes through that break and separates the retina from the underlying layer. This is what causes a retinal detachment. So if you have holes, lattices, or tears in the retina, and if they are treated on time, you cannot develop a retinal detachment. If you have developed a retinal detachment, it's because your cause was not taken care of on time. How will you know if you have a retinal hole or a lattice? Only by seeing a retina specialist and getting a dilated retina checkup done. If you see symptoms like flashes of light or floaters in your vision, see a retina specialist. You could be having a retinal tear. A tear is an emergency as compared to a hole or a lattice, because you can have a hole or a lattice all your life and get a retinal detachment at the age of 50 or 60. Whereas if you have developed a retinal tear, it has happened suddenly because of sudden detachment of the vitreous gel from the retina, and your retinal detachment will happen immediately. That is the reason why a tear is an emergency, whereas a hole is not an emergency. However, it is preferable to laser a hole and not wait for those years to go by and wait for your retinal detachment.